ACCUPLACER Health Professions Exam Prep 2026. Question 1. A study plan assigns 22 review questions per day for 9 days, but 13 are skipped. How many questions are completed? Option A, 198. Option B, 18. Option C, 185. Option D, 484. The correct answer is option C, 185. The completed total is found by multiplying the daily amount by the number of days and subtracting the skipped questions, so the result is 185. The incorrect choices ignore the skipped questions, add unlike quantities, or multiply by the wrong total. Question 2. If 1/2 of a review packet is finished, what fraction of the packet remains unfinished? Option A, 2. Option B, 1/3. Option C, 1. Option D, 1/2. The correct answer is option D, 1/2. The unfinished part is the whole, written as 2/2, minus the completed part, giving 1/2. The incorrect options repeat the completed portion, invert the fraction, or combine numerator and denominator incorrectly. Question 3. Divide 38.4 hours of review equally across 5 sessions. How many hours should each session contain? Option A, 7.68. Option B, 43.4. Option C, 192. Option D, 6.4. The correct answer is option A, 7.68. Equal sharing requires division of the total hours by the number of sessions, giving 7.68 hours. The distractors add, multiply, divide by the wrong number, or inflate the quotient. Question 4. A review score of 76 increases by 15%. What is the new score? Option A, 91. Option B, 87.4. Option C, 11.4. Option D, 64.6. The correct answer is option B, 87.4. A percent increase multiplies the original value by 1 plus the percent as a decimal, giving 87.4. The incorrect choices add percentage points directly, calculate only the increase, or decrease the score. Question 5. A student solves 12 medication math items per minute during a short drill. How many items can be solved in 35 minutes at that rate? Option A, 47. Option B, 23. Option C, 420. Option D, 2.92. The correct answer is option C, 420. A constant rate is multiplied by time, so 12 items per minute for 35 minutes equals 420 items. The other options add, subtract, divide, or add an extra minute's work. Question 6. Convert 135 minutes to hours for a study schedule calculation for review set 35. Option A, 8,100. Option B, 1.35. Option C, 75. Option D, 2.25. The correct answer is option D, 2.25. Minutes convert to hours by dividing by 60, giving 2.25 hours. The incorrect choices multiply, use a base 100 shortcut, subtract an hour, or add an unnecessary hour. Question 7. If x equals 6, evaluate x squared for a quantitative reasoning shortcut. Option A, 36. Option B, 12. Option C, 8. Option D, 216. The correct answer is option A, 36. Squaring means multiplying the value by itself, so 6 superscript 2 equals 6 times 6 equals 36. The incorrect choices double the value, add 2, cube the value, or overstate the square by 1. Question 8. A review block has 5 study sessions of 55 minutes with 12-minute breaks between sessions. How long is the whole block for review set 35? Option A, 275. Option B, 323. Option C, 335. Option D, 72. The correct answer is option B, 323. There are 5 study periods but only 4 breaks between them, so the total is 323 minutes. The other answers either omit breaks, add too many breaks, or add the quantities without repeated periods. Question 9. Find the mean of the practice scores 8, 10, 12, 14, and 16 for review set 35. Option A, 8. Option B, 60. Option C, 12. Option D, 14. The correct answer is option C, 12. The mean is found by adding all values and dividing by the number of scores, which gives 12. The other choices report the median, range, total sum, or a value shifted above the average. Question 10. A question bank has 22 items, and 9 are flagged as difficult. What is the probability of randomly choosing an unflagged item? Option A, 9/22. Option B, 22/9. Option C, 13/9. Option D, 13/22. The correct answer is option D, 13/22. Unflagged items are found by subtracting flagged items from the total, then dividing by the total, so the probability is 13/22. The other answers use the flagged probability, invert the relationship, or use the wrong denominator. Question 11. A table includes points 0, 11, and 4, 11. What is the slope of this horizontal relationship? Option A, 0. Option B, 11. Option C, 4. Option D, 2.75. The correct answer is option A, 0. A horizontal line has no change in y, so the slope is 0. The other values use coordinates as if they were slope or assume a downward trend that is not shown. Question 12. Compute the area of a triangle with base 8 cm and height 11 cm. Option A, 88. Option B, 44. Option C, 19. Option D, 38. The correct answer is option B, 44. Triangle area is 1/2 times base times height, giving 44 square centimeters. The other options omit the 1/2 factor, add dimensions, compute a perimeter-like value, or add height after finding area. Question 13. Select the best central idea of this statement. Clinical students often improve faster when they connect math skills to realistic patient care situations. For review set 35. Option A. Testing should be avoided whenever possible. Option B. Only memorization matters in health programs. Option C. Applied practice can make academic skills more useful for health programs. Option D. Long study sessions always produce the best results. The correct answer is option C. Applied practice can make academic skills more useful for health programs. The central idea should summarize the whole statement without adding a new claim or narrowing the focus too much. The other choices either contradict the statement, exaggerate one detail, or introduce an idea that the sentence does not support. Question 14. Infer the most reasonable conclusion from this note. The advisor recommended a math refresher before the applicant retested. For review set 35. Option A. The note proves the student has already mastered every topic. Option B. The note rejects the value of organized review. Option C. The note focuses only on memorizing answer letters. Option D. The applicant likely needs stronger math readiness before placement. The correct answer is option D. The applicant likely needs stronger math readiness before placement. A reasonable inference must follow from the information given without stretching beyond it. The incorrect options are too absolute, contradict the note, or claim details that are not stated. Question 15. In an academic sentence about health program readiness, what does the word mitigate most nearly mean for review set 35? Option A. Reduce or make less severe. Option B. Measure precisely. Option C. Increase rapidly. Option D. Ignore deliberately. The correct answer is option A. Reduce or make less severe. The word mitigate is used in academic contexts to mean reduce or make less severe. The other choices describe unrelated actions, opposite meanings, or features of writing that do not match the term. Question 16. Why would a writer likely defines a technical term before using it in a paragraph for review set 35? Option A. To distract readers from the main claim. Option B, to make the later explanation easier to understand. Option C, to remove the need for supporting evidence. Option D, to make the paragraph less organized. The correct answer is option B, to make the later explanation easier to understand. A rhetorical choice should help the writer develop meaning, guide the reader, or support a claim. The incorrect options describe weak writing moves that would reduce clarity or relevance. Question 17. Combine these two ideas most accurately. Math placement often affects course sequencing, and health programs may require strong quantitative readiness. For review set 35. Option A. Only the first idea matters for test preparation. Option B. The two ideas contradict each other completely. Option C. Quantitative readiness can influence a student's health program pathway. Option D. Neither idea can be used in academic preparation. The correct answer is option C. Quantitative readiness can influence a student's health program pathway. A synthesis should preserve both ideas and show the relationship between them. The incorrect choices ignore one idea, invent a contradiction, or draw an unsupported extreme conclusion. Question 18. Choose the sentence with correct subject-verb agreement for review set 35. Option A. Neither the advisor nor the students is available afternoon. Option B. Neither the advisor nor the students be available afternoon. Option C. Neither the advisor nor the students was available afternoon. Option D. Neither the advisor nor the students are available afternoon. The correct answer is option D. Neither the advisor nor the students are available afternoon. The verb must agree with the true subject, not with a nearby prepositional phrase or distracting noun. The incorrect choices use a verb form that does not match the subject or create an incomplete sentence. Question 19. Select the sentence with the clearest punctuation for review set 35. Option A. The applicant reviewed fractions, decimals, and percentages before the exam. Option B. The applicant reviewed fractions, decimals, and percentages before the exam. Option C. The applicant reviewed fractions, decimals, and percentages before the exam. Option D. The applicant reviewed fractions, decimals, and percentages before the exam. The correct answer is option A. The applicant reviewed fractions, decimals, and percentages before the exam. Correct punctuation shows how ideas are connected and prevents sentence confusion. The incorrect choices omit needed commas, misuse punctuation between clauses, or place punctuation where it interrupts the sentence. Question 20. Pick the sentence that uses Standard English correctly for review set 35. Option A. Less errors appeared after the learner reviewed the explanations. Option B. Fewer errors appeared after the learner reviewed the explanations. Option C. Fewer error appeared after the learner reviewed the explanations. Option D. Less error appeared after the learner reviewed the explanations. The correct answer is option B. Fewer errors appeared after the learner reviewed the explanations. Standard usage requires correct pronoun case, verb form, and count word agreement. The incorrect choices use non-standard pronouns, mismatched verbs, or less/fewer incorrectly. Question 21. Choose the best transition for the blank. The paragraph explains the scoring range first. Blank, it describes how students can use score bands for planning. For review set 35. Option A. Nevertheless. Option B. In contrast. Option C. Next. Option D. Despite this. The correct answer is option C. Next. The transition must match the logical relationship between the ideas, such as contrast, sequence, or cause and effect. The other choices signal relationships that do not fit the sentence. Question 22. Choose the most concise revision of this sentence. The instructor made a recommendation that students should review the explanations. For review set 35. Option A. The instructor made a recommendation review of explanations. Option B. Students were recommended by the instructor in a reviewing way. Option C. The explanations, by recommendation, were reviewed by students. Option D. The instructor recommended that students review the explanations. The correct answer is option D. The instructor recommended that students review the explanations. A concise revision removes unnecessary words while preserving the original meaning. The incorrect choices are awkward, wordy, grammatically flawed, or less clear than the original. Question 23. Using common medical word parts, what does hyperglycemia most likely mean for review set 35? Option A, high blood sugar. Option B, low blood pressure. Option C, inflammation of a joint. Option D, slow heart rate. The correct answer is option A, high blood sugar. The word parts in hyperglycemia point to high blood sugar. The other choices use different roots, prefixes, or suffix meanings and do not match the term. Question 24. Select the structure that carries impulses away from a neuron's cell body for review set 35. Option A, alveolus. Option B, axon. Option C, tendon. Option D, capillary. The correct answer is option B, axon. An axon carries nerve impulses away from the neuron cell body. Alveoli are air sacs, tendons connect muscle to bone, and capillaries are tiny blood vessels. Question 25. In a controlled experiment, why is a control group useful for review set 35? Option A. It guarantees the hypothesis is true. Option B. It removes the need for measurements. Option C. It provides a comparison for the experimental group. Option D. It changes every variable at once. The correct answer is option C. It provides a comparison for the experimental group. A control group helps show whether the tested variable made a difference. It does not prove the hypothesis automatically, replace data collection, or change multiple variables.